Hi guys, so today I'm going to be talking about what medical interpreters need to do in order to stay compliant to HIPAA. HIPAA compliance is very vital for healthcare providers. It ensures the facility follows all the rules regarding patient privacy, which is very essential. Very important to follow, might I add. So, in the world of patient care, medical interpreters are a very critical part of this equation. I did some research, and about 35 million U.S. citizens who are over the age of 18 do not speak English at home. That's more than 15% of the population here. While some of those 35 million adults do speak English very well, many of them don't. They don't have access to it, and they speak their native language. That is why medical interpreters are so vital. As a medical interpreter, you also have the responsibility to maintain patient privacy. If you're wondering how the HIPAA rules impact you, here's what you need to know. So, HIPAA itself is an acronym, and it stands for Health Insurance and Portability Act. It is a federal law directed by the U.S. Department of Health and Human Services Office for Civil Rights. It outlines the proper treatment of patient information, which is protected by the Health Information Place. So that's the PHI. That's what most people refer to it as. Many of the patient details are in the PHI category. This is the personal identifiable information, which can include name, addresses, phone numbers, dates of birth, where you're living in the moment, social security numbers, all that jazz. That's all in the PHI. So many health benefits qualify for PHI also. They are in the past, present, or future for medical concerns or diagnosis, including physical and mental conditions, appointment schedules, provider names, treatment types, test results, and more. That's what's covered with the PHI. So, within HIPAA, there are also specific rules regarding health insurance coverage retention when changing positions of work. However, these are not super needed to know for medical interpreters, but it's still good to understand them just in case you come across them. So, in the simplest of senses, HIPAA requires medical professionals, including medical interpreters themselves, to safeguard patient data and information. This includes in communication, both verbal and in writing, as those can contain patient details that need to be protected. This is very important. So, now I will go into how there can be violations in regard to HIPAA compliance that can impact interpreters. The main focus of HIPAA is for protecting someone's privacy, which I have stated many times again. Protect the privacy. You must treat all patient information correctly and accordingly. If not, then you are not following the HIPAA rules, which means you are not HIPAA compliant. The penalties for not being HIPAA compliant can be very severe, but it can vary. Some violations can have some crazy fines or maybe even criminal charges. The biggest fines can be from $50,000 to $100,000, or maybe even up to 5 years in prison. So, even if you did not mean to break these rules and it was just a mistake, your fines can still be as detrimental from $50,000 to $10,000 to $100,000, or even jail time. So be very, very careful. So, in order to combat this, here are some simple ways that you can help stay compliant with the HIPAA rules. Number 1, do not discuss patient details with someone who is not directly involved within the situation. This means that you need to ensure you do not reveal any information regarding what happened to the patient to someone who is not involved in the situation. Even if it's a family member, this stays very, very, very secret. Number 2, be cautious when you are not using a protected area of communication, like emails, messages, or anything of that sort, because someone can either hack into it or someone can look at it super easily. You need to make sure this is all protected. Number 3, be sure to dispose or securely store of any papers or information that contain the personal identifiable information. Okay? Lastly, you must stay up to date to the most recent patient privacy laws. Depending on the location, some rules and regulations would be different, so it varies. But you need to stay up to date and research, and this can highly benefit you so you don't get put in a bad situation. So, the main point of this I want to get across is how medical interpreters stay to help the patient and doctor understand and guarantee that the information is being accurately shared and questions are able to be answered. So thank you for listening to my presentation today.